Understanding UTIs. A deep dive. Today, we're diving into a topic that many women have experienced but might not always talk about: urinary tract infections, or UTIs. A urinary tract infection is an infection that can occur in any part of the urinary system, including the kidneys, ureters, bladder, or urethra. Symptoms can range from mildly annoying to quite painful, so it's important to recognize them early. Frequent urination. Your bladder's cry for help. If you're suddenly finding yourself making a beeline for the bathroom more often than usual, it could be your body's way of telling you something's up. With a UTI, this feeling is amplified. When bacteria enter your urinary tract, your bladder gets inflamed and irritated, reacting by wanting to flush things out constantly. It's really about noticing a significant change in your normal pattern. If you're used to going every few hours and suddenly find yourself going every hour or more frequently, that's a red flag. The urgency epidemic. When you've got to go, you've got to go. We're talking about that sudden, overwhelming urge that makes you feel like you can't hold it for another second. This urgency goes hand in hand with frequent urination and is another telltale sign of a UTI. It can be incredibly distracting and uncomfortable, making it hard to focus on daily activities. Imagine trying to sit through a movie or enjoy a nice dinner out when all you can think about is finding the nearest restroom. So, if you're experiencing this sudden and intense urge to go, it's time to start paying attention to what your body is trying to tell you. The dreaded burn. When peeing becomes painful. Let's talk about another super common and often very uncomfortable symptom of a UTI, that burning sensation while urinating. This burning sensation happens because the lining of your urinary tract is irritated and inflamed. Some women experience a mild tingling sensation, while others describe it as a sharp, intense pain. Even if the burning is mild at first, it can get worse if the infection isn't treated. So if you start to feel even the slightest hint of discomfort while peeing, don't wait for it to become unbearable before seeking help. Cloudy with a chance of infection. Decoding your urine's color. Healthy urine is typically clear, or a pale yellow, kind of like straw. But when you have a UTI, the presence of bacteria, white blood cells, and even red blood cells can make your urine appear cloudy, murky, or even change its color entirely. If you notice a persistent change in your urine's appearance, especially if it's accompanied by other symptoms, it's essential to get checked out by a healthcare professional. Something's fishy. When your urine sends up a red flag, changes in the smell of your urine can be a surprisingly telling sign of a urinary tract infection. When you have a UTI, the bacteria responsible for the infection can create a strong, unpleasant odor. We're talking about a pungent, ammonia-like smell, or sometimes even a foul, fishy odor. If you suddenly notice a dramatic change in the smell of your urine, especially if it's accompanied by other UTI symptoms, it's definitely a sign that something's off. Don't try to mask the odor or hope it goes away on its own. Pelvic pain and pressure. When it's more than just cramps. When it comes to urinary tract infections, that pain can take on a whole new meaning. We're talking about pelvic pain and pressure that's often described as a dull, aching sensation, or sometimes even sharp, stabbing pains. This discomfort is usually centered in the lower abdomen, right above your pubic bone, or you might feel it in your lower back or even wrapping around your hips. If you're experiencing this type of pain along with other urinary symptoms, it's crucial to see a doctor to determine the underlying cause. Getting a proper diagnosis and treatment is essential to address the root cause of your pain and prevent the infection from worsening. Blood in the urine, also known as hematuria, can sometimes be a symptom of a UTI. In the case of UTIs, the amount of blood is usually small, and it might turn your urine a light pink, red, or even brownish color. This happens because the infection and inflammation in your bladder or urethra can cause tiny blood vessels to rupture, leading to traces of blood mixing with your urine. If you notice any blood in your urine, whether it's a small amount or a lot, it's crucial to contact your doctor right away to get checked out. UTI fatigue. When your body needs a timeout. Feeling tired and run down can also be a sign of a UTI. Your body is working overtime to fight off the infection, which can leave you feeling drained and exhausted. If you're normally a ball of energy and suddenly find yourself feeling constantly wiped out, especially if it's accompanied by other UTI symptoms, it's worth paying attention to. Your body is trying to tell you something, and it's important to listen. Feeling feverish? Your body's internal battle cry. While not everyone with a UTI will experience a fever, it's definitely something to watch out for. A low-grade fever, usually below 101 degrees 38.3 can be a sign that your body is working hard to fight off the infection. If you're experiencing a fever along with other UTI symptoms, especially if the fever is persistent or gets higher, it's crucial to seek medical attention promptly. Remember, it's always better to err on the side of caution and get checked out by a healthcare professional. Nausea and vomiting. When UTIs hit your stomach, these symptoms usually only pop up in more serious cases, especially when the infection has spread to the kidneys. When a UTI reaches the kidneys, it can trigger a more widespread inflammatory response in the body, leading to feelings of nausea and even vomiting. If you're experiencing nausea or vomiting along with other UTI symptoms, it's crucial to seek medical attention right away. Get yourself to a doctor or a healthcare professional as soon as possible to prevent further complications. Your UTI action plan. Stay informed, stay healthy. If you're experiencing any of these symptoms, it's important to see a healthcare professional for proper diagnosis and treatment. UTIs are usually treated with antibiotics, but your doctor will be able to determine the best course of action for your specific situation. Early treatment can help prevent complications and make you feel better faster. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Thanks for watching, and we'll see you in the next video. Stay healthy and take care.